According to the World Stroke Organization, 1 in 4 people worldwide are likely to suffer from a stroke. 15 million people worldwide suffer a stroke each year, and 5.8 million people die from it. A stroke is a condition where the blood supply to the brain is disrupted, resulting in oxygen starvation, brain damage, and loss of function. In effect, the brain stops functioning temporarily in cases where the obstruction is mild and temporary, while in severe cases, the brain cells die and can cause permanent loss of control to the parts of the body connected to the dead brain cells. The vital signs and symptoms denoting a stroke are paralysis, weakness in the arms, face, and legs, especially on one side of the body, slurred speech, to mention a few. Stroke is a widespread disease prevalent in our society and could affect anyone irrespective of gender, status, age, race, or tribe.
I got to toilet, and while I was there, the first thing I noticed was that I was holding my phone that day using the torchlight of that phone, but I wanted to put it off because I've secured another rechargeable lamp. While I was trying to do that with my right thumb, the thumb was missing the button I wanted to press. So then I felt something was happening. And while I was there on the toilet seat, I discovered that my weight was tilting towards my right side. And before I knew what was happening, I found myself on the floor. So I discovered I could not move my right leg and my right arm. Then I managed to hold something with the left hand, and I called on my wife in the room. She came and she found me there. So that was how the struggle started.
There are simple ways to prevent stroke before it occurs. Control high blood pressure. Exercise 5 times per week. Identify and treat atrial fibrillation. Manage diabetes. Manage stress and depression. Stop smoking and avoid smoky environments. Reduce your alcohol intake. Despite the gravity of the damage caused by stroke and the irreversibility in some cases, it is observed that Nigerians are rarely made aware of the risk factors of stroke until it occurs. It is quite unfortunate that 90% of incident stroke is due to modifiable risk factors, while the recurrent stroke is 80% preventable through optimal risk factor modification. It goes without saying that ignorance contributes significantly to the prevalence of stroke in our society.
I'm here on behalf of my husband, who had a stroke last year, 26th of June precisely. Luckily, he affected only the right side of his body, and he couldn't talk for 5 days. He had difficulties remembering some things. He couldn't walk, and gradually, we've crossed most of those milestones with a lot of physiotherapy and speech therapy.
High blood pressure serves as a cause of stroke, stress, and my own, I cannot really say this is the actual cause because my BP before the problem, I did not used to have a high blood pressure. Well, looking at those other factors, that they are not really the cause. I also want to assume that the cause of my own might be accumulated stress, which I've gone through. Like I said earlier, I did a lot of strenuous things over the past 4 years.
For over 9 years, a medical organization has been helping to achieve these objectives. PHYSIO-FIT Physiotherapy Hospital was formerly Redeemed Physiotherapy Clinic when it was established in 2000. The clinic idea was conceived to fulfill a desire and close the yawning gaps in the nation's existing healthcare delivery systems.
At PHYSIO-FIT Physiotherapy Hospital, we attend to neurological conditions such as stroke, Alzheimer's disease, and Parkinson's disease. We are not left out in orthopedic conditions, whereby we attend to those people that have severe back pain, in neck pain, and probably refer pain to the lower limbs. Also, we attend to patients that have pediatric conditions like cerebral palsy, L palsy. L palsy is injury to the upper limb after delivery. We also attend to sports injuries, maybe someone's played football, or domestic injury, injury to the knee and the ankle. Then we attend to this condition also. And we attend to elderly conditions such as arthritis of the knee, of the elbow, of the wrist. At PHYSIO-FIT, our services can be categorized into four. One is home service, whereby we go to the patient's house and take care of the patient. It has its own advantages and its own disadvantages. Better still, the relatives or the caretaker can be bringing the stroke patient to our facility, whereby we attend to them and then they will take the patient back home. And peradventure, the patient's relatives or caretaker doesn't really have enough time to bring the patient to our facility. We provide our own vehicle, our own ambulance, to go and pick the patient at home, and to go and drop the patient at home also. That is our third option. And the last option is for the patient to be in a medical rehab center.
My experience as a caretaker for a stroke patient has been a very interesting experience. It's very challenging, it's very demanding, and challenging in every sense of the word challenging, and demanding in every sense of the word demanding. But it gives you a totally different view of life when you're going through it.
One challenge is that of movement. To the glory of God, I started walking again, but my movement, particularly the affected leg, drags, and sometimes I have difficulty of experiencing pain, particularly arm, so which sometimes cause me sleepless nights, despite the fact that I was on drug and I was playing some series of exercises.
To stroke patients, they should be positive and see it as a privilege to be alive. I mean, so many people never recover from stroke. So the fact that you're recovering and you are still alive shows God has something in place for you. So don't give up. I mean, keep encouraging yourself.
People will start the withdrawing from you. So that challenge is there, that sometimes people withdraw from you and you feel lonely, you feel rejected, you feel deserted and neglected.
Don't take it personally. Just take it as an expression of a normal human being and move on with life. And then you should also create a lot of avenue to let go of this thing. Learn to ignore a lot of unkind remarks unkind stares, because people like to stare in this part of the world. So I mean, just learn to do away with some of those and just move on with your life, and then focus on the positives and do away with the negatives, and get your life together. Have a work-life balance and a very good relationship with God. Interestingly, it brings the family together because somehow everybody gets to know that we all need one another to support ourselves. So.
World Stroke Day is observed on October 29th to underscore the serious nature and high rates of stroke, raise awareness of the prevention and treatment of the condition, and ensure better care and support for survivors. On this day, organizations around the world have facilitated events emphasizing education, testing, and initiatives to improve the damaging effects of stroke worldwide. The annual event was started in 2006 by the World Stroke Organization, and they declared stroke a public health emergency in 2010. WSO now has an ongoing campaign that serves as a year-round interface for advocacy, policy, and outreach to support strides and continue progress made on World Stroke Day. Together, let's get educated and raise awareness to risk of stroke within our society. When it comes to stroke, according to this year's theme, don't be the one.
One of us might not make it home today. 1 in 4 people will have a stroke in their lifetime. However, most strokes are easily prevented with simple steps. When it comes to stroke, don't be the one.